lateral branches of the spinal nerves.
Just the last two,
Sacral spinal nerves. Sacral plexus should be demonstrated, and this one is sacral plexus. You see it on the anterior pelvic surface of sacrum. This one, you see it. This. Nearly all the parts of this plexus participate in the formation of the biggest nerve of the human body. This nerve is called sciatic nerve. This one, you see, it's nerve, it's not tendon of muscle, it's nerve, you see. And nearly all of them pass through the subpiriform foramen. Subpiriform, it means below the level of piriform muscle. The branches of this plexus divided into short and long. Short are mainly to be distributed in the muscles of pelvic girdle. The long are mainly to innervate the free lower limb. To start with the short one. Before, through the suprapiriform foramen, through this foramen, there are muscular branches which are distributed in the gluteus medius, gluteus minimus muscles, and they are called the superior gluteal nerve. The inferior gluteal nerve goes through the subpiriform foramen, and it enters the gluteus maximus muscle, and also it gives branches to the acetabulum, to hip joint. There are muscular branches which are also short branches to innervate the nearby muscles. For example, the obturator internal muscle is innervated, that is surrounded with gemellus inferior and gemellus superior muscles. Quadratus femoris muscle takes also innervation from it. Tensor fasciae lata, piriformis muscle itself, and also the levator ani, that is the muscle of the perineum, and coccygeus. Long branches. The long branches are distributed to the skin and muscles of lower limb. To skin, we have the posterior cutaneous femoral nerve. To be true, it was not preserved here because the skin was removed. The second is sciatic nerve. You see, it's big, passes through the subpiriform foramen, enters the posterior aspect of thigh. Here it's located between the muscles of the posterior group of thigh. It innervates them. It gives branches to semitendinous muscle, semimembranous muscle, and to long head of biceps femoris muscle. What is more, it innervates the popliteus muscle, located here, and a little bit adductors, together with obturator. The terminal branches of sciatic nerve are called the tibial nerve, nervus tibialis, and common fibular, nervus fibularis communis. The tibial nerve enters the cruropopliteal canal, but before it gives the branch directed to skin of leg. It's called the cutaneous branch. Cutaneous branch to skin of leg. It's called the medial cutaneous crural nerve. It joins the same branch that starts from the common fibular nerve. That is called the lateral cutaneous crural nerve. Together, they create the cruralis nerve. This one, the place where the medial cutaneous crural nerve joins this lateral one. Together, they form the cruralis nerve. It passes to the lateral side of foot to this region and terminated here in the dorsal aspect, the lateral surface of foot. The tibial posterior nerve, after entrance the cruropopliteal canal, innervates, of course, the muscles of the posterior aspect. So it gives branches to triceps surae muscle, to the both heads of gastrocnemius, to soleus muscle, to deep region of muscles, to deep group of the muscles, and terminated in the foot through the medial and lateral plantar nerves. The nerves which are located in the foot, in the plantar surface of foot, are similar a little bit to the medianus and ulnaris nerves of upper limb. What does it mean? The medial plantar, it's directed to the skin of 3.5 toes, to the muscles of the medial side, medial group of muscles, such as the abductor hallucis muscle and flexor hallucis brevis muscle, but only medial head, the first and the second lumbricalis muscles. The lateral plantar nerve goes to the abductor digiti minimi muscle, flexor digiti minimi brevis, to the lateral head of the flexor hallucis brevis muscle, to the adductor hallucis muscle, to fourth and third lumbricalis muscles, and to all interosseal muscles, as well as it innervates 1, 2.5. So it's similar to ulnaris and medianus nerves. Common fibular nerve. Common fibular nerve divided into two branches, but before division it gives a branch to short head of biceps femoris muscle. Divided into two branches, the superficial and deep fibular nerve. The superficial one goes out the superior musculoperoneal canal, innervates the peroneal longus and brevis muscles, directed to the dorsal side of foot, innervates here through the dorsal cutaneous nerves of foot, the both sides of the fifth, fourth, third, and the lateral side of the second toe, as well as to the medial surface of the first toe. That is not innervated by this nerve is the space between first and second toes. The space is not innervated by the superficial fibular nerve. This space will be innervated by deep fibular nerve. Deep fibular nerve enters the anterior aspect of leg, goes together with anterior tibial vessels, innervates the anterior group of the muscles of leg, and terminated in the dorsal aspect of foot in the first intermetatarsal space to give branches to the sides of the first and second toes directed to each other. This one. That is the end of this nerve. So we discussed the terminal branches of the sciatic nerve, the tibial nerve and common fibular nerve, common fibular or peroneal nerves. It seems to be not so difficult, but it's very difficult to repeat all the muscles and topography, all canals, all topography of lower limb. That is your occupation for next 30 minutes. Do it, please. Atlas is here if you want to.